Hello students, my name is Dr. Ashutosh and in today's lecture we are going to understand two very important topic of biomechanics. First is axis and planes, and also I have included a small topic which is friction in this lecture. So let's start today's lecture. First of all, let me introduce you about what is a plane and what is an axis. So a plane is the surface on which the movement occurs or takes place in the body, and axis is an imaginary line around which the movement takes place. You can understand it better by example that if I take this paper and pass a pen through this paper from the middle, and as you can see, when I pass the paper I can move the paper around this pen. So here this pen is actually working like an axis, and this plane, this paper is here representing the plane. So as you can see, the movement is always occurring around this axis. In the same way, axis passes through the joints and the movement occurs around that joint in a certain plane in regards with that joint. Whenever axis is referred, it is a singular term, while axis is the plural noun. Any movement which occurs in a plane around an axis. So remember, whenever movement is occurring, there has to be a certain axis around which it is occurring. Axis of the same plane makes an angle perpendicular to the plane. So here, as you can see in that in this example also, this axis is making a perpendicular angle with this plane which is represented here by the paper. So if I am moving it like this, or if I am moving like this, I can move in x-axis, y-axis or z-axis. In all the three directions, you can see the angle between this paper and axis is always perpendicular. So remember, axis is always perpendicular to the plane, perpendicular to the same plane in which the movement is occurring. Moving on, we must know the following terms before understanding axis and plane. And these terms are very simple, like we already heard them in the first year. Anterior is the surface which is in front of our body, we call this ventral also, and posterior is the surface which is on the back side of the body, we call them as dorsal also. There is something which is called as superior. The superior points are always closer to the head and inferior points are closer to the foot. There is something which is called as medial and lateral. Medial points are always close to the median line which is passing between the body, which is dividing the body into the left and the right halves. So medial points are always close to this median line and the lateral points are away from this median line. There is something called as proximal and distal. Proximal are the points which are close to the body, and distal are the points which are far away from the body. Superficial are the structures which are close to the environment or the surface, and which are close to the skin, and the surfaces which are deep are those structures that are deep inside the body. They are away from the surface. We all know what is an anatomical position. Let me again brief it for you. This is the position of reference for all movements. Whenever we'll study axis and plane, we will study them in relation with this anatomical position. This is also called as standing supine position. As you can see, the person is standing in this position with his arms adducted, elbow extended and forearm in supination position. We can see that this position is used commonly for the reference of studying axis and plane. So this must be clear till now with you, that what is an anatomical position, because this is the position of reference in understanding the movements. Now whenever we will describe the plane, we categorize them into three types. First is the cardinal planes. So there are three imaginary perpendicular reference plane that divide the body in half by mass and represents the axial skeletal movements which is taking place. So these are represented by x, y and z axis. We have studied this in our schooling when we studied about 3 dimensions of this universe. Then there are some parallel planes. These are imaginary surface where movement of appendicular skeletal is taking place. We'll understand them in detail in coming slides. And also there is something which is called as a diagonal plane. So this is a plane that other than the cardinal or parallel planes where movement is occurring in a diagonal pattern. This plane is of peculiar importance because activities of daily life is usually done in the diagonal planes. Whenever we have to lift anything, we move in a diagonal form. So this is an important thing that we must be aware of. So whenever we'll study plane, we'll categorize them into three types. First is the cardinal plane, second is the parallel plane, and third is the diagonal plane. Now let's study about the cardinal plane. What are the types of cardinal planes in our body? So there are basically three types. First is sagittal, frontal, and transverse. So sagittal plane divides the body into left and right halves. So this is the sagittal plane, and this is dividing the body into equal left and right halves. This is that plane. This is passing through the body, and this plane is while passing through the body divides it into left and right of equal proportion. Then there is something which is called as a frontal plane. This divides the body into front and back. So this is imaginary line which is passing like this from my head, and this divides into two equal proportions of the body, front and front and back, as you can see in this example, also in this figure, where this red sort of color is representing the frontal plane. It is passing through the midline of the body and dividing the body into front and back part. There is transverse plane which divides the body into equal top and bottom half. It is represented here in the image by this green plane. So I think this must be clear with you. These are some simple terminologies, that sagittal plane will divide the body into left and right, frontal plane will divide the body into front and back, and transverse plane will divide into top and half. Moving on, let's study each plane in detail and what are the movements that occur in that plane. So first of all, let's study about sagittal plane movements. They are usually termed as forward and backward movement, because in this plane you can only move your body front or back. Whenever we will define the examples of the plane, we will divide them into two parts. First is the whole body movement that is occurring in that place, and then the segmental movements which are occurring at a certain joint in that plane. It is important to study because whenever we are suggesting isolated exercises to the patient, we are concerned with the segmental planes. Whenever we are suggesting generalized exercises or functional exercises to the patient, we are concerned with the whole body. So we must be aware that in which exercises which plane movements are occurring. So let me give you an example of a sagittal plane movement. So in a whole body sagittal plane movement, forward and backward movement, like if you are walking forward and backward, this is a sagittal plane movement. If a person is doing front and back flip, this is also a whole body movement in sagittal plane. Means the body is moving either forward or backward. In the example also you can see, as this lady is performing a lunge. So she is performing a lunge coming forward and going backward. So this coming forward and backward is usually occurring here in the sagittal plane. If we study segmental plane, so flexion and extension of any joint, flexion of elbow, flexion of your shoulder, flexion of your wrist, or extension of your wrist, these all occurs in sagittal plane. And in ankle, dorsiflexion and plantar flexion are the movements that occur in the sagittal plane. Now here you can see this is an example of back and front flip. As I already told you, as body is moving forward, so this is a front flip, and in this front flip the plane which is involved, it is a sagittal plane. If a cyclist is pedaling a cycle, you can see there is a flexion and extension of the knee joint. So this is the movement of a sagittal plane. Forward and backward movements at specific joint, shoulder and ankle are sagittal plane movements. I already have told you about these things, that forward and backward movements occurring at any joint is actually occurring in sagittal plane, because sagittal plane, as I told you earlier also, this divide the body into two halves, which is left and right. Now frontal plane movements, we also refer this by sideward and vertical movements which occur in this frontal plane. If I again first of all let's talk about whole body movements. If you are walking in a sideways, like you are doing a side shuffle, this is a sideward movement. This is actually occurring in a frontal plane. Or if someone is doing a cartwheel, as you can see in this example also, so this cartwheel is actually occurring in the frontal plane. We already heard that frontal plane is passing like this, and it is dividing the body into front and back equal parts. So any sideward movement that is occurring in a whole body is actually occurring here in the frontal plane. Now, what are the segmental motions of this frontal plane? Segmental motions like abduction, adduction, lateral flexion, elevation and depression of the shoulder girdle, upward downward rotation of the scapula, this radial and ulnar deviation. So see, radial and ulnar deviation is occurring in anatomical position. So anatomical position is like this, radial and ulnar deviation. So remember, the reference is always the anatomical position whenever we are describing this movement at segmental level or whole body movement. Also the reference is always the anatomical position. In anatomical position, if you will do radial and ulnar deviation, this is occurring at the frontal plane. As you can see in this example also, there is hip abduction and adduction, ulnar and radial deviation, all are occurring in frontal plane. This is an example of scapulothoracic joint where elevation and depression is occurring of the shoulder girdle, and this is also a frontal plane movement. Lateral flexion of the trunk again is a frontal plane movement. Now talking about the transverse plane movement. This is a horizontal movement. When, as you can see here, the dancer is rotating around a fixed axis. So whenever rotation is occurring around an axis, this is occurring at a transverse plane. Let me give you again the example of this paper and pen. If this is a axis, the pen is like an axis, and if you rotate it like this, there is a rotation which is occurring in the transverse plane. And also we are aware that transverse plane divide the body into two halves, upper and lower right halves, top and bottom. Segmental motions which occur here are medial and lateral rotations. So medial and lateral rotations occurring at the shoulder joints. Left and right rotation of the trunk or head, this supination or pronation. Horizontal abduction or adduction is also a transverse plane movement. Here you can see as the lady is performing the rotation of the spine, rotation of the trunk. This is an example of a transverse plane movement. Again, transverse plane movement, here we can see horizontal abduction and adduction movement which is occurring at a transverse plane. Now let's talk about diagonal plane movement. So what are the movements that occur at diagonal planes? Here there are two examples of the diagonal plane movements of the whole body movements in the diagonal plane. First example, if a person is hitting a golf ball with his golf stick, he is actually moving the body in a diagonal fashion to hit that golf, as you can see in this example also. So whenever you have to hit a ball using, or in a cricket also, if the batsman is hitting a ball, he is moving in a diagonal way to hit the ball. The movement is not always strict in some plane or axis. It is not always occurring in a sagittal plane or a frontal plane or a transverse plane. In the second example, there you can see a pitcher is throwing a ball. So whenever a pitcher has to throw a ball, he has to move diagonally in order to throw the ball. You will see that maximum of activities that we do in our daily lives are actually the diagonal pattern activities. So this is of peculiar interest for physiotherapists to understand about the diagonal plane movements and prescribe the exercises in the diagonal planes in order to correct the injury or to rehabilitate the person. If we talk about the segmental motions of these diagonal plane movements, we can see the example of the subtalar joint. The subtalar joint, if the pronation is occurring, it is actually the mix of two movements, which is abduction plus eversion, and supination is occurring. This is the movement of adduction and inversion. So these two movements do not occur at a strict axis or a strict plane. They occur at the combination of the planes. So therefore these are the movements of the diagonal pattern. Moving on, let's understand what is an axis. Already we have talked a lot about axis, so let's understand this once again. So this is an imaginary line, imaginary axis of rotation that passes through a joint to which it is attached. Axis can also be of three types. They can be frontal, they can be sagittal, or they can be longitudinal. Movement, both type of movements like whole body and segmental movements take place in the cardinal plane. We already studied about the cardinal planes around the axes, which are the cardinal axes. So anywhere the movement is occurring in a cardinal plane, it has to occur around a cardinal axis. As you can see in this example also, this ellipse represents the transverse plane and the black line represents the y-axis. As I told you in the example also, here this pen is representing the axis This pen is representing the axis and this plane is actually a paper. Y-axis is perpendicular to the transverse plane. So this is a y-axis we have studied in the graph, and this is perpendicular to the transverse plane. Therefore, a point which rotates around the y-axis will move in the transverse point. Imagine there is a point in this plane and it is moving around this transverse plane. If the axis is like this, the axis is frontal, the point is actually moving in a sagittal plane. If we change the axis, then we can see the point is also changing. If we are changing the axis, the plane is also changing. First of all, let's understand about x-axis. So it passes from side to side. This is an x-axis. The rotation in the sagittal plane takes place around the x-axis. So any movement which is occurring in a sagittal plane, it occurs around this x-axis. We also call this as a frontal axis. This is x-axis, and if plane is passed, paper or plane is passed like this, the movement is occurring in this fashion. So as you can see, this is the forward and backward movement, or this is a flexion or extension movement which is occurring in a sagittal plane around an x-axis or a frontal axis. Now there is a y-axis which is from top to bottom. This is a y-axis, this was x-axis, and this is a y-axis. This is passing from top to bottom. And if this is passing like this, the movement is occurring in this plane. This is a transverse plane or the y-axis. So whenever the rotation is occurring, as you can see, the dancer is doing a rotation. This is actually occurring around the y-axis in a transverse plane. If I am doing a horizontal abduction and adduction, these are occurring in a transverse plane around y-axis. This y-axis, as you can see, this is a y-axis. This is also called as a vertical axis because it is passing vertically from up to down or top to bottom. Now there is something which is called as z-axis. This is usually passes from front to back. This is a z-axis, and the movement has to occur in this axis. This will occur like this. This z-axis is also called as sagittal axis. So whenever there is a sagittal axis, you can see this plane becomes the frontal plane. So whenever there is a sagittal axis, the plane will occur, the movement will occur in this frontal plane. Rotation in the frontal plane, as you can see, the abduction and adduction movement, they occur in this frontal plane around this axis which is a sagittal axis. You are doing a cartwheel, in the whole body movement also the frontal plane movements are always occurring around the sagittal axis. Now this is the summary of all the things. The center of gravity which is passing, center of mass which is located at the second sacral vertebra. There is a transverse plane which is dividing the body into up and half. Then there is a frontal plane which is dividing the body into front and back, and then there is a sagittal plane which is dividing the body into left and right. And there are three axes: x-axis which is passing like horizontally, there is a y-axis which is passing vertically, and there is a z-axis which is coming out of the body like this. This axis is also called as this sagittal axis. So this was all the summary of axes and planes that we have studied till now. Now let's understand a small topic which I have included in this PPT, which is a friction. So friction is, remember, friction is always a resistance to the motion. Friction does not like the motion to occur. So when an object is moving but it relative to another object, it is always occurring between the two objects. So there has to be some relative motion in order for a friction to occur. It is not a fundamental force like gravity or electromagnetism. Instead, scientists believe it is the result of electromagnetic attraction between the charged particles in the two touching surfaces. So whenever the surfaces are touching, there are some charged particles, and because of that the friction is occurring. Whenever you are there in the cold environment, you rub your hands, you produce, with the help of friction, you produce the heat. So this is occurring between the relative motion. This is occurring as a result of relative motion between the two objects. So remember, friction is always relative to the two objects. As you can see, in all such examples, there are different type of frictions which are occurring in opposite direction of the motion. Friction is always opposite to the motion. It is against the motion. It does not allow the motion to occur. Friction is a catch-all term that collectively refers to all the forces which acts to reduce the motion between the object and matter that are in contact. Friction often transforms the energy of a motion into thermal energy or wearing away of the moving surfaces. So it also transfers this energy into thermal energy. That is why when you rub your hands, you feel hot. Or it can also cause the wearing away of the moving surfaces. If you scratch something with the help of with friction, they can also remove that part of that surfaces. So this all things occur because of because of friction. There is some equation for friction. We usually divide the friction into three parts, which is kinetic friction. This is the friction which acts when the two objects, when one object is moving and other object is stationary. So there is a motion which is occurring in the kinetic friction. In static friction there is no motion occurring, and in rolling friction there is a rolling of movement which occurs. The friction force is approximately equal to the normal force multiplied by a coefficient force. We all know that there is always a normal force which acts on a body. It is always proportional to, my normal force is always proportional to the frictional force, and for the equation there is a constant which is called as the coefficient of the friction. Now let's see what is a symbol of a friction. Friction is usually represented by a capital F and a small f, and its unit is same as that of force. Its unit is in newtons. Friction always it depends on two factors. First factor is the weight of the object. If the weight of the object is more, then the force will be more. If the force is more, then the friction will be more, because it is directly proportional to the force. Friction is directly proportional to the force. Second thing on which the friction depends is the nature of surfaces. As I told you earlier about this coefficient of friction, this coefficient of friction is actually different for all the objects. The coefficient of friction for ice is lesser than the ground, the hard ground of a soil. So that is why you find it difficult to walk on ice, because there is lesser friction compared to the ground. It is easier to run on a grass ground compared to running on a ice, because of the lesser friction on the ice surface. There are basically two types of frictions. First is static friction and the other is kinetic friction. Static friction always operates between two surfaces that are not moving relative to each other. If this phone is actually resting on my hand, so here the static friction is there. When I rub this phone on my hand, there is a kinetic friction which is occurring, because there is a relative motion with respect to each object. Now let's understand some other type of friction. So basically, moreover, we divide the term friction into two parts, static and dynamic. There is also something which is called as a rolling friction, which occurs whenever the surface which is moving is rolling is occurring. It is a circle which is moving. Like if the tire is moving on a road, it is a rolling friction which comes into picture. There is some thing called as fluid friction, which occurs in water, because there are a layer of water in between those. There is a fluid friction. This usually occurs in the phenomena when we are doing a swimming. Now kinetic friction is a sliding friction. It is a force that resists sliding or skidding between the two surfaces. If a crate is dragged, as you can see in this example, the crate is dragged into the right direction and friction is pulling it into the left direction. As I told you earlier also, friction is always opposite to the motion. Friction acts in opposite direction. In the other example, the crate is inclined and at an angle which is inclined, and then also if the motion is occurring, friction is always parallel and opposite to the motion. In both the example, it is clear that friction is always opposite to the motion. It is parallel also. If I ask you that where it will take more force to push over a rough floor, if there is a board without any brick and there is a board with 3 bricks on it, you will surely say that this is difficult to pull out the board with the bricks. Of course, because the friction is more there, as the friction is always perpendicular to the force, and we know that force is always proportional to the friction, is always proportional to the force, and force is always proportional to the mass. So whenever the mass will be more, there will be the more friction occurring in that situation. There are some laws of kinetic or dynamic friction of which we must be aware. First law is that we already studied that friction is always acting in a direction opposite to the movement of the body. Second thing, the magnitude of this kinetic friction bears a constant ratio to the normal reaction between the two forces. In a simpler word, this magnitude of the friction is always proportional to the normal force. It is directly proportional to the force, directly proportional to the mass. If force is increased, then the friction will be increased. If the mass is increased, then the friction will be increased. For moderate speeds, if the motion is in a moderate speed, the force of friction remains constant. but it decreases slightly whenever the speed is increased between the relative motion of the two objects. So remember these three laws of kinetic or dynamic friction whenever we will study them inside our body. First is that the friction is always in a direction opposite to the motion. Second is that it is directly proportional to the force. Third is that for a moderate speed it remains constant, but when the speed is increased very high speed is there, then the force of friction decreases slightly with the increase of speed. Now, static friction, it is also called as a gripping friction. It is a force that prevents the relative motion between surfaces when they are contact with each other, with the contact with each other. Without static friction between your feet and the floor, you could not walk. If there was no static friction, then it was very hard for us to walk. If I'll ask you to walk on a surface where the oil is spilled, you will find it difficult, because your feet would slip as there is a lesser friction. Without static friction between your tires and the road, you could not start or either stop your car. So this is a model for the static friction, where the maximum static friction force is acting between two surfaces in the coefficient of static friction, and there is n, which is the normal force. This mu represents the coefficient of the static friction. There are also certain laws that we must know of static friction, like we read about the kinetic friction. First of all, as kinetic friction, or direction is always opposite. Second thing, magnitude of the force of friction is exactly equal to the force which tends the body to move. If I have to move this phone on my palm, I have to apply a certain force. If I apply the lesser force, this will not move. Then when I will apply a force that is required to move this object, this will start moving. So the minimum force that is required to move the object is actually equal to the static friction. So remember this thing, the static friction, or the magnitude of the force of the static friction, is exactly opposite to the force which tends the body to move. Also, there is something third point in this law, which is that magnitude of the limiting friction bears a constant ratio. We already studied in the kinetic friction that F is directly proportional to this limiting friction. The force of friction is independent of the area of contact. It does not depend on the contact area between the two surfaces, whether the contact area is more or less. The static friction will always remain constant for the relative motion of those two objects, without talking about the surface area or the area of contact. Last thing that we must know is the force of friction depends on the roughness of the surfaces. If the surface is very rough, then the friction will be more. It is hard to drive a car on a road filled with a lot of holes and pits, because the road is not smooth, it is rough. In the same fashion, if two objects has to move, the other objects on which the motion is occurring has to be smooth. So whenever there is a roughness, the force of friction will be increased. So these were the two laws. These were the laws that we must know about static friction, and in the previous slides we read about the laws of the dynamic friction. So that was it for today's lecture. I hope it was clear with you what is an axis, what is a plane, and what are the types of planes in our body, and how are the movement occurring, the whole body movement and the segmental motions. Also, we read about the friction, the types of friction, static and dynamic friction, and the laws which are governing the static and dynamic friction. Thank you. That was all for today's lecture.